Welcome to the Medical Device Made Easy podcast. Here is Munir Al-Azouzi from easymedicaldevice.com. And today we will talk about MDR again, because MDR is, we are close or we are already MDR. I don't know when the episode will be released, but if you are listening to that and we are already MDR, so today we'll talk mainly about how companies are feeling about EU MDR. And I have with me Catherine Higginson from Climedo, so marketing manager at Climedo. And Climedo has made last year a survey about EU MDR, and they made again a survey this year. So last year we had episode 98 with Catherine, and we talked about that. And she came again to give us a follow-up about the new survey that they have done. So Catherine, welcome to the Medical Device Made Easy podcast.
Hi, Munir. Thanks. It's good to be back.
Great. So as I've said, so you were here last year. We talked about that. It was really an interesting episode because we learned a lot of things about how, if I can say, the manufacturers were thinking about the EU MDR. What was their assumptions? There was also a lot of uncertainty. There was a lot of things that were not clear for them. So the first maybe thing that we will talk about is mainly a difference between, if I can say, the previous survey and the new one. But before that, so for people that don't know you, maybe never had seen the previous episode, so can you tell us more about you, who you are, and maybe a bit about Climedo also?
Mm-hmm. Sure. Yeah. So my name's Catherine. I'm the marketing manager at Climedo Health. We're a software company from Munich, and we offer a platform for electronic data capture. So mostly clinical data capture, where we work with medical device companies and also pharmaceutical companies.
So great. And so Climedo, where are you located again?
Munich, Germany.
Munich. Okay. So Germany. So Climedo mainly, I mean, you are doing this survey for the EU MDR. So it's not specifically a survey for your products for Climedo. It's really a general survey. So to just have an understanding of the context of EU MDR, which is great because then it's not, as I said, focused on marketing for Climedo, but mainly also gathering information which can be helpful for anybody there. So in terms of, as I've said at the beginning, so the difference between what we have seen last year and this year. So for people, as I said, if you want to see what we have made last year, so it was episode 98. You can see exactly what are the questions. I think there is still the link of the previous survey, so maybe you can still get there. I don't know. You can still access to the.
It's still accessible.
So the link is on the show notes, so you can still access to the previous survey. And here we'll provide you on the show notes the new survey, the link with the new survey on the show notes, so you can look exactly at all the questions that we'll talk about today. But from your point of view, because you maybe made a kind of an evaluation before, after, what are the main differences or the main changes or maybe the similarities that are between the previous survey that you have done and the new survey? So first, was there exactly the same questions?
So it's actually two surveys that we're comparing it to. So it's a bit more complex. One we did in the spring of last year, and that was just to check companies' level of readiness at all. That was before we knew that the MDR was going to be postponed. And then there was the second survey, which is more towards the summer, autumn. That's the one we talked about more specifically, and that was to do with the costs. So we've taken some questions from both of those surveys, and some are completely new as well, though.
So how many people were participating to those surveys?
This one, 115. That was a new record. And last year it was between 102 and 110 each time.
Great. So maybe it's nearly similar, so we can really make a good comparison instead of having really a lot of differences. So what is your summary out of that then?
So in terms of the differences, there were four things that kind of stood out. The first one was that the MDR is perceived as slightly more challenging this year compared to last year, despite the postponement. On a sort of percentage scale, last year, 77% said very challenging, and this year it's 81%, so marginal difference. And then in terms of the individual challenges, because we always like to ask that, like what's the difficult part about the regulation, here the number one challenge this year was increased resources and costs. And in second place, it's lack of clarity. And last year it was the other way around. So that might suggest that, okay, it's become more expensive or more resource intensive, but it's also become a bit clearer, perhaps.
In terms of what is surprising is that, what is good maybe also is the fact that we had since last year, a lot of new guidance, a lot of new information about EU MDR. So you have to do it on that way. It has two options on that thing. It's the fact that when there was no guidance, so you had some assumptions how to do things. So you say, okay, I'll do it on that way. It's easy for me. And when the guidance is issued, it's like, oh no, I should do it in another way. It's more difficult for me. So which makes it, if I can say, a bit harder for some people. Or in the other way, when the guidance came, you say, okay, you have to follow just step 1, step 2, step 3. So it's easier for us. We don't have to think. We just have to execute, and then it's fine. So there can be also the fact that more documents, more guidance, more implementing acts were issued, which helped, if I can say, those manufacturers to have more clarity on how to execute things.
Exactly. Yeah, that was also mentioned by one participant later on in the comments. So yeah, we can take a look at that.
Related to the cost, so last year, how much budget they were having for this EU MDR?
Yeah, that's an interesting one. Yeah, last year I think 48%, so just under half, said that they thought it would cost them more than 5% of their annual turnover, and this year only 44% said the 5%, basically.
So it means that it will cost more for them?
This year, slightly less or fewer people believe that it will cost that percentage of their
maybe they had
turnover.
more experience, they had started to execute, and they saw maybe that it was... but yeah, it's still a budget, if I can say, for some companies that have to execute that. So it's not something that will be just, as I say, it's not just one document or two documents to create. It's really a full system that you have to create out of that. One of the things that I also noticed is the belief related to the finding a notified body. So this is something that we are saying mainly. It will be a struggle because we don't have a lot of notified bodies. But out of the 115, it's not something that was the most challenging for them, finding a notified body. I suppose those ones had already maybe a notified body. And luckily, those notified bodies were already accredited. So it's not like something that they had to look at.
Yeah, exactly. I think last year around 50 people said that they had a notified body, and this year 70%. 70% say that they have one, and 10% don't need one. And so that means 20% do still need one, and they're still in the process of getting one.
Yeah, we have actually 20 notified bodies under MDR. Last year we had 15 or 13 or something like that. So there was some kind of progress. So I hope, this will be continuing to progress, because we need notified bodies to be able to place medical devices on the market. And this is something that companies cannot work without. So, and we can maybe look at that just after. But one of the questions was the fact of, so we know that last year, the date of application for the EU MDR was on the 26th of May 2020. And due to the coronavirus, first we said, no, this date will not change. It's exactly the same day. There is no postponement, etc. I remember we were saying that. And then suddenly, because of coronavirus, we can change this date easily, if I can say, because it was like 1 month to make decision, and to implement was 1 month to say, yes, we will change and we will postpone of 1 year. This year, I will not say it's impossible, but we are now close to it. It's like 14 days before the date of application. So we had one additional year then. Your survey was asking this question. So did the postponement of the EU MDR help the 115 customers or manufacturers?
Yeah, this was kind of the $1 million question that we were really curious about as well. So the answer is yes, mostly. 57% said yes, it helped them. They also explained why it helped them, which was quite interesting to see. So they said it relieved the pressure, especially for Class 1 devices. The planning became easier. The government or the European Commission had more time to publish documents. More notified bodies could become certified, and there were more best practices to follow. So that's good news. And
was there some negative thing to say, no, we don't?
Yeah. They were allowed to comment as well. Yeah. So the 43% that said no, they said, well, nothing's really changed. The requirements are the same even after 1 year. And some say there are still not enough notified bodies. I guess 20 is still not that much or that many. and that the pandemic has made things difficult for companies. So they've had their hours shortened and they've actually had to deprioritize the MDR. And now suddenly it's waiting again and the deadline is looming. And some say actually that they were already MDR compliant last year before the postponement was announced. So it didn't really make a difference to them. So that's why they said no.
Yeah, there is two categories, as you said, of companies, the ones that already were ready, so it doesn't change anything. And the one that were not ready and were pushing to be ready. But when they heard about this postponement, they said, okay, let's move to another project. We have still 1 year more for that. And they just moved to another project and few months before say, oh, let's come back to this project. Oh, we are late. We have to be doing that. So yeah, it's something that, is human, if I can say, to say, okay, it's not anymore a priority. So let's move to something else, but it becomes a priority again. So related to notified bodies, as we discussed, so due to this postponement, there was something that was also critical, is the fact that notified bodies couldn't perform an on-site audit. So many notified bodies, they were not able to do that because of the pandemic. And at one point, so even if there was a postponement, the ones that were ready couldn't get certified because notified bodies were not able to come and to visit them and to do things. And at one point, January this year, they authorized again the virtual audits, only with a lot of requirements or exceptions to say, if you are in that case, plus that case, plus that case, plus the member state authorized, plus, a lot of things, which I'm not sure it helped. A lot of people were using that, but your survey was asking this kind of question. So what was the result about that?
Yeah, so surprisingly, 60% said they had made use of virtual audits, which seemed like quite a lot to us, considering there are all these conditions you have to meet to get one. But I guess it's also a good sign because lots of unimaginable things have become virtual now, thanks to Corona, kind of. 20% said no, they hadn't used them, and 20% weren't sure if their company had used it.
And as we said, so there was also some not fair situation in this virtual audits because some member states authorized that, some notified bodies to use that, some member states didn't authorize that. So it was like not fair for some customers because if they were with one notified body, it was fine for them. If they were with another one, it was not fine for them, etc. So it's something that we didn't really appreciate in terms of that. But yeah, it's they have their proper decision on that. Actually, I have no clue now what is the situation because I don't know now if there are a lot of virtual audits that are made. But it's something that is also a big problem is notified bodies. First, there is not a lot, and then they have difficulties to make on-site audits. So it's also something that makes it a difficult time for the manufacturers to get certified for EU MDR.
Yeah, definitely.
We had also a section because, as I said, you are Climedo, so you are a software company that is capturing clinical data. So you had also some question about that. So what was the result for those type of questions here?
Yeah, so we always like to know, what kind of tools are you using or methods are you using to capture clinical data, since that's a huge part of the MDR, especially in the post-market phase. And here, unfortunately, there wasn't a huge difference compared to last year. So the majority is still relying on paper and Excel for their data capture, and around a third are using software for both years. Even though because then we also asked about the benefits of paper and Excel, and most companies said they see no benefits in them, and they're definitely not time saving or anything like that. And those who are using a software said the biggest advantage is that it's practical in use and time saving and cost saving. So of course there is an initial investment you need to make in a software, but long term it saves you a lot of administrative hassle and therefore also time and money. And interestingly, we also asked what's the biggest challenge in general, like regardless of the system you're using for data capture. And here the biggest challenge was the time required. People also mentioned things like lack of qualified personnel or high costs, but time required was number one.
Yeah, I think there will be a switch, if I can say, to digital software, digital products anyway, because we were doing that also with the quality management system to move from paper to EQMS, so electronic quality management system. So there will be a lot of those switch that will be done in digital things, but it's true that the idea for companies that are new it's easier for them to move to this kind of solutions than for companies that were doing paper since a long time, and then they have to convert all those documentation to digital. So to transfer that is like kind of a nightmare. I don't want to hire somebody else for that. It's time consuming. Let's continue like we were doing. So it's things like that. But at the end, and I think I had also other episodes with digital transformation. So where we said that, we can save also some personal sense of, save some time for that. Okay. So out of that, so now of the survey, so there was also some great comment at the end. So what else was there at the end related to the EU MDR from those manufacturers?
Yeah, I mean, at the end, we also asked, what do you think are the advantages of the MDR? And the top advantages named were traceability and transparency, which I guess is the purpose of the MDR. So that's a good sign, along with safety. But unfortunately, 1/3 also said they saw no benefits at all. We wanted to offer that as an option in the MDR. And then we also said, what would you like to see more from the European Commission? And here 3/4 said they want clearer guidelines. So even though we saw that maybe things have become a bit clearer after 1 year and there's more documents, they still want clear guidelines from the Commission. And half also want professional support related to their area. And then other people named training, more communication, more collaboration. And interestingly, very few wanted any financial support, which I guess has other implications once you go into that area, despite it being financially very challenging.
Yeah, it's if I can say, a lot of people are, as you've said, are looking for some guidance, for really clear guidelines, because there is also things that are not clear even for us when we talk about clinical data, because we talk about that specifically. So what is clinical data? What is enough? What can be used for that? So how can I convince my notified body that I have enough data for supporting the product? One comment that I saw, if I can say there, is also that it's too much bureaucratic, the EU MDR. The Commission is not practice-oriented, so meaning that mainly it's a lot of requirements which cannot be in place or cannot be easily implemented by some companies. But as we said, the EU MDR is also more than double the pages of the MDD and the AI MDD combined. So it's like 60 pages, and this one is 75 pages. So it's a lot. This is a lot of requirements that even maybe small companies cannot fulfill. And the idea here is really that only the ones that are really able to fulfill those requirements can continue their business, and the others should stop what they are doing. And this is, I think, the idea of it. But what we are doing, so mainly we are helping small manufacturers to show them that it's not so complicated, or we can find solutions. But to be honest, with the EU MDR, there is a lot of more requirements, which makes it sometimes, as mentioned, bureaucratic. But sometimes, if you understand well what is behind that, you can really think of, okay, we can do it in that way, which is still fulfilling the requirements. So I think for me, it's a good outcome, if I can say, or kind of the good progress in terms of saying that, we are still moving forward. We have now a better understanding of the EU MDR, but we still see that companies put on their top, if I can say, some lack of understanding, or some needing more guidances. So there is still a lot of guidances that will be issued this year. The MDCG is working on that. The agenda is full of guidances that need to be released again.
That's good.
But I hope that there is more clarity now, and also with the work we are doing here at Easy Medical Device, with all the podcast episodes, etc., that we get a lot more work. So just maybe for people to have a better understanding of what is Climedo, because the idea is also that I like this kind of digital tool. So what can you, if I'm using Climedo, so software, what can I achieve with that specifically?
So you can, we can't take away the MDR requirements, unfortunately, but we can make clinical data capture much easier for companies. So you can move away from paper and Excel and just capture everything in an electronic format, which means it can also be shared with relevant parties immediately. There's no programming skills required or anything like that. Anyone can set it up and just see all the results in real time, see if there's any kind of serious adverse events that they need to react to. And it also makes things easier for patients and doctors or whoever is using the device. So, for example, you can print a PMCF survey link as a QR code on your devices, and then the device users can scan the QR code and give feedback right away via their phone, instead of having to fill in a paper survey and post it and hope that somehow it makes it into the evaluation. So it just saves a lot of time and hassle.
So did maybe just a question in terms of coronavirus, did coronavirus help you, or it was more a problem for you?
Yeah, I mean, at the beginning, right after the postponement was announced, a lot of companies kind of leant back a bit and said, no, we don't need that right now. But then towards the end of last year, suddenly there was a lot more demand and people realized that they can't manage anymore just with paper and Excel, and that they need to move to a digital solution. So
I think for me, it's more like data can be transferred without paper, so without also visiting the doctors or visiting the centers or visiting the things, so you can directly collect the information more accurately in a proper way, instead of sending an email with some Excel sheet or that are maybe not secured, or maybe the data were not correctly put inside. So for me, the idea of putting this distance also due to coronavirus is maybe helping such devices to develop, because mainly the idea here is less contact, because to avoid contamination, and in that way a digital format where it helps you to fill the data. I suppose also it helps maybe the practitioners, the people that are filling those information, to say, instead of me writing an email or filling an Excel sheet, I have really a formatted document that is really helping, and I just click on a button and it sends it directly to the people.
Exactly. Yeah, you can do it on any device, so it's mobile responsive and everything like that. And that's a good point with Corona. I think people are definitely becoming more open now to digital solutions, and things like web meetings have become a lot more common rather than a classic phone call or meeting up in person. So things are definitely changing in the medical device industry too. Great.
So so if you need a clinical data acquisition tool, so then go to Climedo. So you will have the link on the website, so climedo.de for Germany. So you will have the link on the website on the show notes, and then you can go directly to LinkedIn and ask Catherine, I think for any question regarding Climedo. So okay. So thank you really, Catherine, for your support and also the survey. So will you do again a survey next year after EU MDR, if it was really what they were thinking?
We'll see. Yeah. I'll have to think of new questions then. Definitely, see how things are kind of going. And also we're getting requests now for IVDR surveys even, because that's the next thing where there's even fewer notified bodies.
Yeah.
So also interesting.
So don't forget, IVDR is coming. So actually we have MDR is coming, but now IVDR is coming, and we have only 4 notified bodies for IVDR, and it's a shame, if I can say, because you will have much more manufacturers that will need notified bodies with IVDR than what we had with MDR. So it's something that will be a nightmare, I think. So if you are IVDR, don't forget IVDR is coming, and you have really to think about it now. So don't hesitate to contact us also if you need any support or you have any question. I will be happy really to answer that to you. And do we need Climedo for IVDR?
It can be used for IVDR as well. Yeah, we've already got our first
evaluation, I think, for this activity. So don't hesitate also to contact Climedo if you are IVDR, if you need anything from there. Okay, so Catherine, really was a pleasure to have you again. I hope to get you again next year, maybe for another survey, and we will see exactly what is the progress of that. So Catherine, I wish you really a nice day.
Great, you too. Thanks so much.
Bye-bye.
Bye.